Hello everyone, welcome back to How Does Psychology Apply to ABA? This video was part 2 of Schedules of Reinforcement. If you haven't seen part 1, you may want to go watch that video before continuing on. Let's jump right in with our first clinical scenario. This example will cover the fixed ratio schedule. Suppose we have a younger client who is not actively engaging in the program. We need to establish an MO. Or in other words, we need to create a motivating operation so that the client will actively work on the program. We might do this by blowing bubbles after every 3 times the client answers a program question. Because we have 3 consistent instances of the target behavior producing reinforcement, this is an FR3. Our next clinical scenario will cover the fixed interval schedule. Let's say we have a younger client who's interrupting their parent while driving. This problem behavior could be dangerous if the distracted parent got into an accident. We need to teach the client to wait to ask for attention. But in order to prevent other challenging behaviors, we want to start out small and work up to more time. So we could start out by reinforcing by providing attention whenever the client asks for it after a 4-minute interval of sitting in the car. This intervention may require an additional intervention in order to teach the child how to ask for attention. Remember, we don't provide reinforcement for the target behavior during the 4-minute interval. This is because we're teaching the child to wait, so we don't want to provide that reinforcement, the attention, during the interval. Then, once the interval is over, we deliver the attention. Thus, this is an FI4. Now let's examine a clinical scenario using the variable ratio schedule. Let's say we have an older client that we have an established history working with. They may not need a fixed rate of reinforcement in order to keep an MO and actively work on the program. So, maybe after approximately each 5 trials while running a program, the client gets an iPad. So, the first session, they might get the iPad after 4 trials. Then the second session, they might get the iPad after 6 trials. And then on our third session, they might get the iPad after 5 trials. This averages out to 5, so this is a VR5. Now let's look at a variable interval schedule clinical scenario. Suppose we are prepping a client to go on a trip to a theme park. We're going to work on patience while standing in line. Specifically, our target behavior of interest will be greeting or thanking the ticket taker. So, the time in line varies, but it equates to about 10 minutes. The intervention that we may apply may be waiting in a line of peers. We're going to deliver an activity reinforcer, time on the swing, after standing in line for approximately 10 minutes and then greeting or thanking the ticket taker. The intervals or the amount of time standing in line will vary each trial but average out to 10 minutes. So this is a VI10. Our last clinical scenario will cover continuous reinforcement. Let's say we have a client who's engaging in self-injurious behavior in order to escape classroom work. So we might have applied a DRA in which we reinforce the alternative behavior of asking for a break. We're going to consistently deliver reinforcement each time they ask for a break. So this is continuous reinforcement.